as I mentioned. Tonight we're going to have an interactive conversation. We're going to hear from our brother Young and his story and about his advocacy on cardiovascular disease. And also, if you have a story you'd like to share, that would be helpful to some of us, you will have time for that as well during the question and answer period. So, with that, Brother Young, welcome. And we appreciate you taking time on your birthday to share some information with us. So with that, I'll open it
Absolutely.
to you.
Absolutely. I appreciate the opportunity to present on this important information. So let's get started. The theme of this presentation is community advocacy and cardiovascular disease. And pretty much it's a personal testament to my health modification and purpose-driven life shift. Okay, so let's get started. Um, the areas we're going to cover in this presentation, we're going to talk about heart disease in America, more specifically, heart disease among our community and the African American community. Also, I'm going to touch on my journey personally through heart failure, and then as well, how I transition, from being ill, severely ill, to curtailing that into community advocacy, and then also touch on, some of the variances of the advocacy work I've been doing over the years, over the past 10 some years under the American Heart Association. Okay. So let's start the baseline of this conversation in terms of what is heart failure. Definitively, heart failure is a chronic disease. Okay, so what does that mean? There are two different distinctions when it comes to heart failure. You have individuals who have what's called congenital heart failure. Those are conditions where people are born with heart conditions, and it's something they will have to manage pretty much for the rest of their life. My area of focus in this discussion is talking about chronic heart failure. Chronic heart failure impacts the majority of heart failure patients, particularly in our community. And what is chronic? Well, chronic is something that uh, happens over a period of time. It's a progressive development of a disease, right? And pretty much definitively, heart failure is a chronic and a progressive condition in which, the heart basically can't function. It can't pump blood and oxygen throughout the body as it ought to be doing, right? Um, with that, also, when the heart is unable to function properly, as I would oftentimes say, our heart is so, and our body in general sometimes, is so intelligent that it can actually adjust itself in an attempt to manage, in this case, the distribution of blood and oxygen throughout the body, right? But that's not a positive thing in that sense because the heart enlarging itself is becoming larger than what the size or the capacity is supposed to be. So eventually, if the heart is at that level of expansion, eventually it's going to exacerbate, as they say. And that's when a person may fall into a heart attack or a stroke or a cardiac arrest, for instance, right? So that's something to be mindful of in terms of heart failure. What are the signs of heart failure? Um, Shortness of breath is a very common one. If you find yourself not being able to climb several flights of stairs, for instance, if you are walking, for instance, and you find yourself being out of breath, that is a potential sign that something may be going awry with your heart. Fatigue is another thing. If you lack energy throughout the day, if you're feeling tired during the day, that's also an indicator that something may be going troublesome with your cardiovascular health. All right. Swelling is another sign of heart failure. A person may experience swelling in like their lower extremities, in terms of their legs. Um, I know when I had heart failure, I was able to take my fingers and impress my fingers on the side of my legs, and it would leave a deep indention in my legs, right? Like, yeah, literally an indention, a deep indention. Um, so that's a sign of heart failure. And some people may experience this or not, or may not even realize they're experiencing this, but irregular heartbeat, or what's also called afibrillation, where the heart is outside of its what's called sinus node. It's outside of its rhythm, right? Now, that may not be readily identifiable with a lot of people, but I know in my case, when I was having congestive heart failure, I can actually like literally see my heart beating out of my chest and also feel that the rhythm was off in certain instances as well. Another sign of heart failure is a persistent cough, and it's usually a dry cough that a person will experience. And as well, sometimes that cough could be actually painful as well. I know in my case, I had the same situation where I would cough sometimes and I would actually have to brace myself because that cough felt like someone taking a bat and hitting me on my side. And so I would brace myself because the cough would be so impactful that I would brace myself to not fall, right? So those were some, with me, some of the classic signs I was experiencing prior to actually being officially diagnosed with these conditions. Risk factors that placate into a person, eventually being diagnosed with heart failure, congestive heart failure, or anything of that nature. Some of the contributory factors or risk is a person that has physical inactivity. Our bodies were designed to be ambulatory, right? We were designed to move and be physically active. And as many of you know, in this society we live in today, um, there is constancy of what they call sedentary behavior, where people sit a lot, they watch TV for arduous hours, they are on their phones or iPads for several hours, and there's little to no movement generally on any given day. And that actually contributes to heart failure, potentially. It also contributes also to cancer, but that's another discussion. Um, Other risk factors are family history. There are genetic factors that play into a person developing heart disease at some point in their life. That's something else. If a person finds that their family members have died of heart attacks, strokes, cardiac arrest, what I advise is that even if you are not, a candidate for heart failure or having any of these symptoms, it would be wise to go with your primary care doctor and have them do at least an EKG, an electrocardiogram to look at the functioning of your heart. If you have a family history of it, it's just wise to do that so you can do preventative measures, right? Age and gender plays a factor as well. Um, Men over 45, women over 55 have increased risk of developing heart disease in our community. Also, stress, chronic stress, and not being able to manage stress in your life. That's one of the silent killers, in fact, that placate into a person eventually having some sort of cardiac diagnosis. And obviously, an unhealthy diet, which I'll dive into a little more in depth in this presentation, but obviously eating a lot of foods and high fats and high cholesterol, fried foods, and things of that nature, fatty foods, obviously plays into eventually a person having clogged arteries and things of that nature that makes them high risk for cardiovascular disease diagnosis. Now let's get to the facts. Obviously, heart disease, and maybe many of you don't realize this, but heart disease actually is the leading cause of death in the United States, and it has been that way for a number of years. Some people may be under the presumption that cancer, for instance, is the leading cause of death because tends to get a lot of marketing exposure, right? You don't see a lot of marketing behind heart disease, right? But when you look at the data, uh, it's the leading cause of death, regardless of race, gender, socioeconomic status. It is the leading cause of death in this country presently, and as well the world. 1 in 4 deaths in the United States is caused by heart disease, and coronary artery disease is the most common type of heart disease, and it occurs in arteries supply blood to the heart when the heart or the arteries become narrowed or blocked, puts a person in a predisposed position for a heart attack or stroke or cardiac event. And there are also other types of heart failures as well due to those types of factors. Now, let's talk about our community. Let's talk about the African American community, which I've been passionate about for a number of years. Um, and as you can see, and I want you to pay attention to the bar graph I've created there. Um, right now in the United States, we are a secondary minority at this point, right? However, being a secondary minority, we have the highest prevalence of heart disease comparatively to the majority white population. And these are like real current numbers. So in our community amongst Black men and women, we're right there at 60% of us in this country right now have some sort or form of cardiovascular disease. That's what you call a disproportionate number because we're a minority population, but we have a higher prevalence of that condition compared to the majority. That is severely alarming when you look at that. Black men have a 70% higher risk of developing heart failure compared to white men, which, white men being the majority population in this country. As far as hospitalizations, Black adults account for over 50% of heart failure hospitalizations in the US. Mortality rate, African Americans are 45% more likely to die from heart failure related hospitalization than white Americans. Their early onset, there are 20-fold higher incidence of heart failure in young Black adults before the age of 50. And see, that's a misnomer there. People think heart disease and heart failure is just an old person's situation, right? Uh, I know Paul knows this, or past Grandmaster Robinson knows this, but when I was diagnosed, I was 40, right? When I was diagnosed with 3 types of heart failures, right? And so that was uh, a wake-up call for me to look at this condition. Like it's not just something that happens in our senior community at all. And hypertension, 58.4% of Black women and 57.5% of Black men have high blood pressure. I'm not sure how many of you realize this, but in our community, we have the highest rates in prevalence of unmanaged high blood pressure than any other population in this country, comparative to high blood pressure in the world, just our population in the United States. And of course, high blood pressure is a severe precursor and a silent one when it comes to a person developing heart disease or any form of heart disease. It's that unmanaged blood pressure, right? So that's something to keep in mind as well in terms of the facts. And again, risk factors: high blood pressure, high cholesterol, smoking, diabetes, and obesity are major risk factors for developing heart disease or having a cardiac event. When you look at this chart here, blood pressure stages, ideally, your blood pressure should be 120 over 80 or less, right? And as you see here in the chart, anything above that places you in the high blood pressure range or different variances of what they call hypertension, right? Uh, that blood pressure is the baseline for everything. Because when that blood pressure is out of range, it can cause some issues, major issues, particularly with your heart and your kidneys, for that matter. Now, let's get into my story. Now, I tried to get AI to create this image here. I'm a little more tan and with these images here, but I guess it looks like me. But it tells a story. Okay. So when we look at my story, it's going to tell something about what I just discussed in terms of the information, right? Well, what it's also going to do is show how I took a bad situation and turned it into something positive in my life to the point where it totally caused me to do a pivot in my life in terms of my trajectory and my life's purpose. Okay. Now, prior to being diagnosed with the three types of heart failures that I was diagnosed with, this was pretty much my diet. If I could sum it in a way, this is what I was doing. I was eating a lot of fast foods, a lot of, Coney Islands and things of that nature on a regular basis. I was a heavy smoker. I was a heavy drinker as well on a constant basis. And that went on for roughly about 3 years of, that type of behavior, right? So as a result, over a period of time, I began to develop certain symptoms, right? Some of these I discussed in a previous slide. But one of the things was shortness of breath. I noticed when I would climb stairs, I couldn't breathe or I would be out of breath. I would have to really walk in snail's pace and things like that. Progressive weight gain was another symptom. And that was due to the fluid retention, as I mentioned previously. I was gaining a lot of fluid retention in my legs and my midsection. Sleep apnea. In my case, it was hard for me to go to sleep at night because I would cough. I have this persistent cough all night. Also, I was actually afraid to go to sleep, because something in me knew something wasn't right with me. And so I would actually force myself to stay awake. And obviously, after so many days of staying awake, it just made me very difficult in terms of being able to function throughout the day. And in terms of the heart palpitations, I actually could feel my heart beating out of my chest because that's how hard my heart was trying to work. And it had enlarged, unbeknownst to me until I actually was hospitalized. But my heart would beat like I could be fully clothed and I can actually see my heart beating out of my chest, like just pumping back and forth out of my chest. Um, I was spitting up blood. That was another symptom. I spit up blood. Sometimes the blood would just be, just blood, or sometimes it would be coupled with phlegm as well. And then there was the, again, as I mentioned, the persistent cough that I was experiencing. So those were some of the classic symptoms I was experiencing. By the time I was hospitalized, my injection fraction, and for those who don't know, the injection fraction is the percentage of how well or not well your heart is actually pumping blood and oxygen throughout the body. So by the time when I actually made it to hospitalization or into emergent care, my heart was functioning at 13%. Let's put that into perspective. Your injection fraction for someone with a normal functioning heart, a well functioning heart, should be functioning between 50 and 70% in that range. So, if you take that and then look, compare that to what I just explained with my condition, 13%, right? Um, the other issue was the acute systolic congestive heart failure exacerbation, right? That means that when I came into emergency, the top number when you're doing your blood pressure reads, you have your systolic and then you have what's called your diastolic numbers, right? That bottom number. So my top number when I was brought into emergency back in 2011, it was at 274. So if you think about what I mentioned earlier when I showed the chart for the normal range, ideally for your heart, for your blood pressure, 120 over 80 or less. So when I actually was in emergent care, my blood pressure was 224 and my bottom number was well over 100. Also, because of my history with the heavy drinking, they diagnosed me with what's called alcoholic cardiomyopathy. So when I came into emergency, they uh, diagnosed me with that, not only because I admitted to them that I was drinking heavy, but also I had a certain content of alcohol still in my system that kind of confirmed with them that diagnosis. And prior to this, I had no idea what alcoholic cardiomyopathy is, but and many people may not realize that when you talk about alcohol or excessive alcohol drinking, people oftentimes associate it with the liver, right? Lower liver disease, not realizing that the excessiveness of drinking alcohol impacts every aspect of your body, not just your liver, but in my case, it was my heart as well as my kidneys as well. The other diagnosis was heart valve regurgitation. That was an issue as well, because my valves were leaking. My heart valves were leaking when I was brought into emergency. And then the other diagnosis obviously was hypertension because I had unmanaged high blood pressure. And then I was also diagnosed with chronic kidney disease as well. Um, all those factors at the same time. So, what did I do? Well, sitting on that hospital bed, I had a lot of time to think and reflect. And the fact is, being honest with myself, I knew exactly what I was doing to myself. I knew exactly what it was. I was not in denial, right? So as I was released from the hospital, uh, I began to make little changes here and there. I didn't do anything drastic or just major. I just made very simplistic changes. So I knew I was drinking too much. So I actually, you know, very extreme, but I quit drinking alcohol totally. Eventually, I was able to quit smoking cigarettes. I instantly quit drinking sodas, minimize my sodium intake. And one of the major ways I was able to do that was through, stop going to Popeyes and to the Coney Island. And, one of the things I would tell people is there was one Popeyes I would go to, which is not far from me in Highland Park. I was going there so often that they knew what I wanted before I even came up to the counter, right? They knew exactly what I wanted. So that's how predictable I was. That's how habitual I was going there on the regular, right? So I knew I had to cut that out, right? A very important thing I also began doing was physical activity, which I wasn't doing prior. So I actually was able to started going to Martin Luther King Junior High School. I started going there and just walking around the track. And one of the things I found, based on research, is that walking in itself, not running, but just walking, has tremendous impact on your health and on your cardiovascular health. You don't have to do anything extreme. You can just do very slow, brisk walk around the track for maybe 30 minutes a day. It actually, and if consistent with it, it can make a tremendous impact on your health and cardiovascular health. Also, one thing I wasn't doing that I began doing was increasing my hydration. So I started drinking more water and understanding the importance of water and hydration, right? That made a tremendous turnaround in my recovery as well. And then I also dealt with or resolved the depressive behavioral issues that caused me to drink heavy or eat bad excessively, things of that nature. I started to deal with the things that were eating me so I could eat better, right? Resolve those things in myself that was causing me to use these things as band-aids to, address it in a more appropriate way to have a better health outcome. Okay. Then I began to move into community advocacy, right? Because then I realized as I began to do more research on our community in particular with heart disease and how the disproportionate those numbers are, I wanted to do something um, on this new lease I have in life to do more work in the community to make more people aware of this. And so I began planting my feet in community advocacy, working in the community. So that involved raising awareness and being a part of different functions around the city of Detroit that dealt with raising awareness around cardiovascular disease, improving access, bringing resources to underserved communities so they could screen themselves, check their blood pressure, do health screens and things of that nature, on a preventative level, right? Represent patient and community voices and listening what the people are going through and what are the impediments that they're experiencing that's causing them to not make the proper decisions in terms of their health. And then it went into influences with policy and systems, which I'll talk more in depth shortly, and then targeting those health disparities, through culturally responsive outreach and community partnerships. And so those were the initial steps I took to get involved and really, get out there and start sharing my story with individuals. That's where it comes into the American Heart Association. I met the American Heart Association back in 2016. Prior, the Ebony magazine did a national story on me. I'm in one of their last physical magazines, before they went totally digital. I'm in one of their last physical magazines. And from that article, the American Heart Association locally reached out to me, and we had a sit down meeting because they had never seen, more so specifically, an African American man talk candidly about his experience and talk about heart disease in the community. So they were very interested in partnering with me in that regard. And from that, I began to speak at health facilities around the Detroit metropolitan area, health events in general, and as well as doing local media and partnering with the American Heart Association to bring more awareness to different markets. And from that, the American Heart Association, they exposed me to all these different outlets you see here, and there's others, but these are all the different outlets that ultimately I was able to share my story, as well as talk about the concerns of heart disease in our communities across the United States. And this was all due to the American Heart Association making these opportunities affordable to me. From that, they moved me to the national level where I was media trained by the American Heart Association back in 2016. I was media trained by them to represent them on a national level. And so I had opportunities where they would send me to different events, scientific sessions around the country, and I would just share what I've been doing in the city of Detroit, as well as, impressing upon them the importance of focusing and doing more work addressing the disproportionate numbers of prevalence and incidence of heart disease among our people in the various Black communities around the country. Also, they made me one of their uh, national heart failure ambassadors. So all of these folks you see here are all friends of mine. We've worked together since 2016 in various events. But the purpose of the National Heart Failure Ambassadors, we go around to different events and we interact with the people. We talk with media. We do all sorts of activities, not only promoting the mission of the American Heart Association, but we also share stories in an effort to motivate and inspire other individuals who are undergoing similar circumstances to help, let them know that there is hope and there's a brighter side to it. And we utilize our voices and our examples of how we live, to make that example happen for a lot of people that we've been able to touch over the years. Also, I'm a patient representative in science with the American Heart Association. So in 2017, I was approached to sit in on meetings down in Dallas, Texas. I had no interest in science or research at that point at all. But they invited me down because they were interested in having people who were non-scientists who sat in on meetings to discuss research proposals presented by many of our top research institutions in the United States who are looking to address variances of heart disease in the United States. So I was one of their guinea pigs. And so I sat in on these meetings, and it just really blew my mind to have this opportunity to sit on this committee or committees and interact and interface with Johns Hopkins University, Harvard University, Vanderbilt, NYU, all these, Emory, all these top universities, research institutions. It had a profound impact on me because I utilized that opportunity to be a voice of our community. So when a Johns Hopkins University, for instance, or Stanford or Yale would present before us, and they were proposing funding for a study that focused on African Americans, um, that was my opportunity because oftentimes I would be the only Black person sitting at the table. So I use that as a double purpose, not only to represent AHA at those tables, but also utilized it as a means of making sure and ensuring that our people are properly represented in these proposals that they're looking to be funded as well. And because of that, those experiences led me back to school. And I actually, uh, because of those profound experiences I had with AHA, I decided to go back to school and one, finish my bachelor's at Eastern Michigan University, which I completed in 1 year, graduating April 2021. And then I went on and got accepted into Purdue University in West Lafayette, Indiana, where I actually earned my master's in public health because those experiences and those committees, I decided I wanted to make a pivot in my life and and not only volunteer, but I wanted to make my entire professional purpose about serving the people and bettering, our communities in terms of public health. And so I went on and earned that master's degree, which I'm very proud of, December 2023. And I'm presently awaiting determination on my doctorate studies at Tulane University, where I'm looking to pursue my doctor of public health there at Tulane University as well. So I'll know about that next month. So the takeaways from this presentation uh, is very direct. So stick to a healthy diet the best you can. Begin some sort of physical activity to the best you can. Incorporate more fruits and vegetables and lean proteins into your diet. Obviously, the bad fats, the fast foods, and the high salt content and the heavy alcohol. To the best of your ability, try to moderate that. Smoking, for instance, is something, I know that's a difficult thing to address and remedy, but that's very important because smoking is like, the most horrible thing you can do. It really is. Um, and even cigars, and I know people may argue the cigar piece, but anything you're inhaling in terms of smoke is going to have impact on you. And it's going to ultimately have impact on your cardiovascular health and your arteries and things of that nature. Um, one of the silent killers reducing stress, the things that bother us, um, is, focusing on that and addressing that. And one of the ways is, exercising can be a great way. And like I said, you can just do something as simple as just walking, just going for a walk 30 minutes a day. That can help curtail any type of stress you might be experiencing. Obviously, sleep is important. And I know, that's a struggle with some folks, but sleep is very important as it relates to your cardiovascular health. I know there are some people who experience, like I mentioned earlier, sleep apnea, apnea um, that, not being addressed can affect your heart over a period of time as well. Another thing, if you have history of heart disease in your family, I would suggest, even if you not having any issues yourself, I would suggest that you would get an echocardiogram or through your primary care doctor or through a cardiologist specialist, just to see where your heart is functioning, just to learn what your injection fraction is, as I mentioned earlier. I think that's one thing people can get an understanding of, what's the percentage of my heart right now? Is it below 50%? Is it above 50%? I think every Black person needs to know the percentage of their heart functioning, their injection fraction. So that's something I suggest. And knowing your numbers in general. I know for me, for a number of years, I refused to go to the doctor. I wasn't going to the doctor at all. So I wasn't even getting at minimal my annual physical. And I'm proud of myself because yesterday I was able to go to the doctor and I got my physical, right? Got my lab work done. So soon I'll know what my numbers are. But I've made a habit of that over the years. But knowing your numbers is important. Also, everybody should have a blood pressure device in their home to be able to take your blood pressure or learn how to take your blood pressure on a regular basis as well. So you can see what those numbers are as well. I did a piece in the Wall Street Journal as a past Grandmaster Robinson mentioned, but that article that I was a part of in the Wall Street Journal, we talked specifically about the proper ways of taking your blood pressure at home. And that's very important because taking it properly, you know what your numbers are. When you go to your doctor, you'll be more wise in terms of how how they should be taking your blood pressure. Because sometimes I've had some doctors that didn't take blood pressure well, like the method that they used was not correct. And the issue with that is um, a person taking your blood pressure incorrectly could lead to a misdiagnosis. So you might have good blood pressure, but if the person's not taking your blood pressure right, it might give you a higher read, or vice versa. And so that's something important to learn as well. Okay. And also, if you're looking for support, the American Heart Association, through heart.org, their main website, they have a support network. So if you're actually interested in getting more information on how to support yourself cardiovascular wise, I would go to the support network website. There, not only can you meet other individuals who may be going through heart disease diagnosis and be able to connect with them to encourage each other. You can also utilize it to identify cardiologists if you're trying to find an American Heart Association affiliate cardiologist in your area. It's an interesting system they have where you can find that. You can learn about learning CPR, for instance. It's a ton of information on there, in terms of diet, and it's a plethora of information on that site. So I encourage everyone, you can get to this support network through heart.org. And you'll find all the information you need that can help support you in that regard. Okay. And lastly, through my own experience, and that's me running a half marathon, Detroit Free Press Marathon. Um, but I use this image as a figurative one where when I talk about people and their health, and they're trying to improve their health or get on a path to health, I always make it known that your health is a marathon, it's not a sprint. So, like for instance, if you get in a situation where, in my case, where I was diagnosed with heart failure, congestive heart failure, systolic heart failure, and whatnot. That was a marathon journey to get myself back on the right path, right? So there's no quick remedy for that. There's no pill you can take, a drink you can drink. If it took you a while to get to this point, it's going to take you a while to come out of it. And so I would say have patience and view it as a marathon rather than a sprint. Okay. And that concludes my presentation this evening. And I thank everybody for listening. And at this time, I would be willing to entertain any questions you may have.
Yeah, Brother Young, we just want to thank you for sharing your story. Uh, we've had a personal relationship for a while, and I remember when you were, diagnosed, and we had a conversation about that. So uh, I was telling you back then, even that you were an inspiration to me, even though I haven't acted on a lot of it, but you did put some things on my mind as well. Uh, Full transparency, I was even in August of 24, I had an episode. I went to the doctor and my blood pressure was almost 200, and they sent me immediately to the hospital. And that was a wake-up call for me. I was getting ready for a celebration, and had a lot of activity going on, and had a caterer come through, and he brought some samples, and it was just salty. And but I sampled his food, but the next day I had a doctor's appointment, and that's what they found. So since then, I'm taking some corrective action, but had it not been for that, I probably would have just ignored all the symptoms that you mentioned before. So
Mm.
it's a real thing. Do we have any other questions? I know we do have uh, at least one other person on here who would, I've asked to share their story. But if you have questions, now's the time to do that. If you're on mute,
I
you
don't
can.
have any questions. Um, I just want to make a comment or a quick comment, if you will. Thanks again, Brother Young, for sharing your story. Uh, um, we've had many conversations over the years as well. as you've gone through different stages, and to see your progress from the hospital bed to where you are today is truly a remarkable one. Um, and that kind of inspirational progress that you have documented and have no problem sharing in these kind of platforms, even individually, because you've gone to small and large scale events alike, as well as anybody who actually have a conversation with you will share that as well personally. Just continue to do what you're doing, good brother. Just know you have people here that will support you and do support you on that journey. Stay praying for you to keep doing what you're doing and be that beacon of light for most.
All right. Appreciate that, Brother Dwight.
And I have a question for uh, Dr. Young. Is it doctor yet?
No, not
Not yet.
doctor yet.
Not yet.
No,
You're
that's
close.
yeah, that's close.
It was concerning the family history. Are you referring to just your immediate family, brothers, etc., sisters, etc., or are you talking about your overall frame of family, cousins and so forth?
Actually, both.
Okay.
I'm glad you asked that question, actually. When my father was alive, my father passed in 2014. Okay. The last days of my father, he was doing some interesting things. To your point, one of the things he approached me about was he wanted me to put together a spreadsheet, right? He just randomly came to me one day and said, I got these things written down. I want you to put it in a spreadsheet. I said, well, okay, well, what is it? He said, these are like the immediate family, the immediate family that's here in the city, right? And then some of the family maybe I remembered at some point or another. He said, but what I did, I created these columns. So I have the name of the family member, when they were born, when they passed away, and what they passed away from. And he said, I'm doing this for a reason. He said, because oftentimes we go to the doctor, for instance, right? And, for instance, if we go into a new doctor or a new primary care provider, right, they might ask us about family history, right? And then sometimes we might sit there and be kind of baffled because we don't know, like, okay, well, I don't know what this person died of. I know they passed, but I don't know what they passed of. Or this person, I don't know anything about the origin of their death, right? So my father decided to create this sheet. And then I took it and, made it a little more fancier in Excel, right? But once it was completed, he printed it out. He gave it to everybody in the family. And he said, take this and give it to your primary care doctor so they can have it on their record. And so that way, when you're looking at yourself in terms of conditions that you might develop or conditions that you've currently been diagnosed with, they can have a chronology or some sort of history to look at to say, okay, apparently this is what's going on in your family. There's a trend of this. And it's a better way for them to address it, a more effective or strategic way for them to address it, right? Than just somebody saying, well, I'm not sure what my aunt or my uncle died, or I don't know. I have no idea. You have something on black and white that you can hand to them. And that way, that can make your personal care with your physician a lot more effective because they could see like, okay, well, there's something going on in your family line here because everybody's passing away from the same thing. So, you know, that makes them a little more wise in terms of how they're going to address you as their patient, you know. So that's something that my father did. And I always suggest that people do that if they haven't already.
Yeah, it's a good idea. I did ask another brother, past Grandmaster Page, to come on. Some of you may know about his journey as well, but just ask him to come on and kind of share where he is now, how some things transpired with him and where he is currently. You may be on mute, Brother Page. while he's doing that. If anybody else has any questions or um, comments, please feel free.
Yeah, good evening once again. Brother Young, definitely want to commend you on a outstanding presentation and just want to reiterate how proud I am of your journey, having been in constant communication with you over the years, from the very beginning to the point where you are now. And I know you and I have talked about some of the health challenges I've personally experienced due to
You,
hypertension over the years. And one of the things you did touch on with hypertension led to chronic kidney disease. And for those who may not be aware, I am personally dealing with chronic kidney disease and currently have to do dialysis treatment. And my situation was brought on by untreated hypertension. So that's something that I personally advocate people for to make sure you monitor your blood pressure. And as Brother Young alluded to not too long ago, knowing your family's medical history. And I had no idea that hypertension and kidney disease ran in my family. So that's something that I wish I would have known earlier. That way I could have taken the proper preventative measures on that. But
Yeah.
once again, Brother Young, I definitely want to commend you on an outstanding presentation and happy birthday once again.
Yeah. Well, real quick, before Derek says something, what I do at Wayne State, I work in the School of Medicine, the emergency division of research, right? Part of that component is we have what's called, and some of you might be familiar with it, but it's called the Wayne Mobile Health Unit. Anybody familiar with that? It's the mobile unit service you might see at different events. Um, I know they've done some things at certain Prince Hall events as well. Um, but the purpose of the mobile health unit, as Brother Hayes was talking about in terms of hypertension, um, the doctor I work under is Dr. Philip Levy. He is the brainchild behind the Wayne Mobile Health Unit that started during the pandemic. Initially, it was to address the underserved and vulnerable communities to make sure that they were tested for COVID, right? But through that ordeal, they also realized they can expand that service to address or look at preventative health, right? So the Wayne Mobile Health Unit, part of its main service is to deal with hypertension and blood pressure. So one of the main services it offers for free is to test blood pressure of individuals. Um, Also, I am work directly under Levy as a part of his research team. So I'm actually the clinical research retention coordinator. So I'm over two major research studies. One is funded by American Heart Association. That's a $2.6 million study on hypertension and low cardiovascular risk African Americans in the Detroit metropolitan area. The other study I'm on is a $1.6 million study with the National Institute of Health that is looking at working with African Americans in the Detroit metropolitan area who are stage one, stage two hypertensive, right? So we're actually in the community addressing the very thing that Brother Hayes is talking about, because to his point, many of our people are succumbing to chronic kidney disease because of unmanaged blood pressure. And so that's one of our figurative points and service points. What we do with the mobile unit is to address that, bring people into the study so they can learn how to manage their numbers. They can work with our pharmacists so they can better understand the medications they're on to help bring their numbers down. That's the real important work that we've been doing since the pandemic with the Wayne Mobile Health Unit. So yeah, so knowing your numbers again, and lastly, get a blood pressure device. Invest in one, have it at home, take your blood pressure regularly, so you know your numbers, because that blood pressure unmanaged is a silent killer. It's literally a silent killer. So it's very important to know your numbers, especially among our people. So I digress.
Thank you.
Can you hear me? Can you hear me, Paul?
Yes, yeah, thank you.
Okay. Good evening to you, Past Grandmaster Robinson, um, Brother James Young. Thank you all for inviting me on. It's been very informative. With James, you and I go back to the cheeseburgers and the Coney dogs. So
That's right.
a few years after I hadn't seen you, I didn't know who this brother was after he had changed his diet.
Yeah.
Over the years, I truly appreciate all the information that you share with me, and it don't really hit home until something happened to you sometimes.
Yep.
But with my experience, it takes me back to 2017, and probably earlier than that when just didn't know what was going on with me. But I had a stress test because I had been experiencing, you know, periodically sweats and a little dizziness when you bend down to tie your shoe and
Yep.
stuff in that nature. So, I mentioned it to my primary doctor, and I did a full stress test in July of 2017, and only to be diagnosed with a quadruple bypass in September of 2017. But in my case, it was high cholesterol. My blood pressure, even through the stress test and all that. And I was on cholesterol medication. But, and even now, last month I went to have my physical, it was 122 over 79. So my blood pressure has always been pretty stable. It was the cholesterol. And at that time, one Saturday, my wife and I went to a funeral. Got back home, sitting on the couch, and you mentioned earlier about actually feeling the internal movement, inside your organs or whatever.
Hmm.
Well, I could feel my arteries. I didn't know what it was at the time, but I felt some movement in my chest and my heart area that I hadn't felt before, And it wasn't from doing push-ups or it wasn't a muscle. It was a little more internal. So I told my son, I said, well, we might have to go take me to emergency because something don't feel right. Only to find out after I was diagnosed and that two of my arteries were 98% closed and the other two were over 50% closed. So here we go, quadruple bypass.
Hmm.
The doctor, he said he took my heart out, put it on the table. He rebuilt it and put it back in. And it was challenging. The whole recovery was challenging, and now you knew about it as well.
Hmm.
You shared so much valuable information with me that I still, you know, still live by to today.
Hmm.
But I'm proud to say that, I stuck to the script. It's been 9 years now. It'll be 9 years in September, and I'm pretty much back doing, things that I've done as a younger man. As far as riding I'm not a walker, but I ride an exercise bike,
Hmm.
and I do some push-ups, and even do a jump rope, But I'm back to doing all those things, and I agree with you. The diet is very important. Change my diet. Some things you just have to do in moderation.
Hmm.
And on top of that, I'm a diabetic. So trying to manage the two,
Hmm.
a diabetic and, um, heart patient, you know, just got to be thankful for each day and follow the script.
Hmm.
It's there for a reason. That blood pressure, cholesterol, and high cholesterol is it's not as bad as high blood pressure, but I eat a lot of beets, beet juice, stuff
Hmm.
that beets they really good for your for your blood pressure. But
Hmm.
that cholesterol, it's a different animal, totally different animal.
Hmm.
So far, I've been hanging in there though. I race you around the block.
Okay, I'm gonna take you up on that.
All right.
And then Paul can be at the corner with the oxygen tank.
Yeah, I won't be racing with you, that's for sure.
Oh,
I appreciate you, man. I mean, you've been, I'll call you in a minute if I got a question. So,
yeah,
you know,
yeah. And another thing is that people that are interested in getting a gym membership and things like that. One thing I found out, even with my health insurance, state of Michigan actually has a program where some of them real fancy gyms, like Lifetime Fitness or LA Fitness, and some of them places that charge ridiculous monthly rates. The state of Michigan has a health initiative where you know, depending on the insurance you have, and it's something I think everybody should look into, but you can actually get into some of those gyms like with a fraction of the cost, based on the health insurance you have. I know people may tend to shy away from those facilities, but that's something I learned,
yeah,
like I think I only pay $20 for my membership at LA Fitness. And I think everybody else I work around, when I'm there in the gym working out, I think everybody in there is paying like $50 a month or something. And I'm paying a fraction of that. And that's because of, the insurance that I have. So I always encourage people to look into that to see if they qualify for that.
yeah. You mentioned about the blood pressure monitor. Since that time, I've always had one here at the house. But you mentioned about using it properly or improperly, because my numbers are always slightly different than the one when I go to the doctor. I mean, they don't be that far off, but maybe a number or two. But I just wondering what did you find the difference as far as using the one at home
No.
properly or improperly?
Okay.
I
Because
mean,
I've gone through that.
'cause I had them put it over my shirt. Some of them they roll your sleeve up and put it directly on your skin. So,
which is how it should be done. But
all
yeah.
right, okay, that's what I
Yeah.
but I've been to the doctor and they've done it over my shirt.
Hmm.
Yeah,
Yeah. When I mentioned that Wall Street Journal article I was a part of, we talked about that. Um, I had one doctor, you're supposed to be relaxed when they take your blood pressure, right? And a cardiologist I was seeing a couple years ago, I would come in there and he would literally take my arm and raise it up like this
Yeah.
and put the cuff on my arm. Now I'm stressing at this point, right? I'm stressing.
Mhm.
And so obviously if I'm stressing, guess what? My number's going to be elevated, because I'm not relaxed. My arm is up here. My arm's supposed to be rested, with the palm up. And so I had to leave him alone. I had to find me another cardiologist. But yeah, there are proper ways to do that to take that blood pressure read. And sometimes those doctors they're not doing it properly. They're not even allowing the person to relax. you know, to settle before they actually put that blood pressure device on, Um, and I'm sure, as you know, and everybody else knows about what they call the white coat syndrome. When you walk in, you automatically are at high anxiety, which causes your blood pressure to be elevated as well, because the white coat syndrome, that's a real thing as well.
Yeah.
Yeah.
Right. Right. Yeah.
I found that to be interesting when the last time I went, it was about 2 months ago, and they had me have my arm all the way up in the air. And I said,
Mm.
that has never happened before. That's the
Mhm.
way they took it, just like I got my arm up in there. Is that normal?
No, it's not normal.
I didn't think so.
No. There's a proper way when they're taking that blood pressure. One, they're supposed to allow you to rest.
Hmm.
Is it the issue with me when I would bring this up? I would come in, sign in for my appointment for that day, and then like 5 minutes after that, they bring me in the back. And then as soon as I get into the room, sit down, somebody's coming in there dragging the blood pressure device in, throwing it on my arm, and all this movement and everything's going on around me. And then they say, "Oh, Mr. Young, your numbers is high." I said, "Well, you think?" I said, "Y'all dragged me in here. I'm sitting. I didn't even get a chance to inhale or exhale. I'm sitting here and you throwing this thing on my arm and the machine making all these noises and stuff like that. And yeah, my number is going to be high." I said, "But give me 10, 15 minutes to relax, then come back in and do it." I have to tell them that, and I know they're on the schedule, and that's how they operate. They're on the schedule. They're trying to get you in and out, in and out. But as I said earlier in my presentation, sometimes that could lead to misdiagnosis a lot of times, and they end up throwing you on medication that you don't even need to be on, you know, and that's a reality as well. But yeah, a lot of these doctors, I have to question them only because I know the proper way to do a blood pressure read, you know. And I say, no, no, take that again. Nope, take it again. I say, now let me rest my hand because my hand's supposed to be positioned a certain way. It's supposed to rest and palm's supposed to be up, you know, and give me a chance to breathe and relax. Then take it, you know.
Right.
And yeah, but you have to communicate that to them. And a lot of people just allow them to do whatever they want without that communication. But that's very important.
That speaks to that whole self-advocacy piece. We have to,
Exactly.
like you said, communicate and talk about, things that are impacting
Yeah.
us. Do you have any other questions or comments or anything? And Brother Page, thank you for sharing. Appreciate that.
You're welcome. You're welcome. Anytime. Anytime.
Hmm.
We yeah, that matter of fact, since you spoke on that, James, when I went to the doctor last month, uh, the nurse, when I spoke about when she put the when she put it on my arm, she put it over my shirt. But when the doctor seen me, he said, "Oh, that number, I don't like that number." He said, "Take your shirt off."
Hmm.
And he checked it again, and it was 122 over 79.
Right.
Different number from what she got.
Right.
Yeah, I was just staying there with my mother-in-law last month. That's good information, to spread. Another thing too, my mother, she was a heart patient. One of my sisters was a heart patient. And just what you spoke about earlier, that's a good idea of, documenting all your family members, that had whatever type of illness. Um, I know this is about the heart, but cancer's been kind of running through my family a little bit too here. So, you know, but all those things are good to document.
Absolutely.
We have a few minutes left, but um, I know that there were a couple sisters on the line. If they have any questions or anything. All right, Maxwell, stop, man. Right, well, if there are no more questions or anything, I want to first of all thank you, Brother Young, for coming on and sharing. This was good information, and I would like to encourage everyone to you know, look at the takeaways from this presentation, and certainly keep an eye on your blood pressure and the other health factors in the impact of cardiovascular disease. I also want to thank Brother Aaron Dickinson for helping us out technically with the technical assistance. Appreciate that. And also you, Past Page, for sharing yours. Those of you who had questions. Again, this is something that the network is trying to be more proactive with. You'll be hearing more about what we're doing and the re the reasons for the network and its purpose. If you have some thoughts about presentations we can have, feel free to share those. Send them to me. You have my contact information. We even contacted Grand Lodge and drop a note. So my dog done ran out of patience with me, so I'm gonna have to go ahead and take care of him. But again, thank you all for calling in and participating. I really appreciate that. Have a good night.
All right. Take care.
James, I'm gonna get with you.
All right. Thanks, everyone.
All right.
Got a cousin that's on the heart donor list.
Okay.
I'm gonna give you a call. We talk about it.
All right. No problem.
Okay. All right. Thank you. Thanks for everything.
All right. Take care.
Good night. Yep.